All right. So tonight we're doing the episode 3 assessment tools, informed consent, and budget, basically the other components of the proposal. Here with me, I'm having my dear colleague Dr. Khani, who's gonna present this part of the course.
Okay, thank you, Dr. Mohammed. So, as previously said by my colleague, today we'll be discussing the last part of proposal development, which is the assessment tool, informed consent, and budget. So this will be the outline of presentation today. We will go over basically the same thing we just mentioned. So objective 1 is how to develop an assessment tool. We have 4 main outlines. We'll discuss open-ended and closed-ended questions, formatting, wording, and common pitfalls that researchers do while developing an assessment tool. So open-ended questions, they ask about what the respondents say in their own words, and they require a qualitative type of analysis. Closed-ended questions, respondents have to choose from 2 or more pre-selected answers. So in simple terms, multiple choice questions. Quicker and easier to answer, and the answers are easily tabulated and analyzed. But they have one drawback, which is that they might lead the respondents in a certain direction. They don't have the freedom of open-ended questions.
Okay, so I think it would be useful if we can discuss certain examples of the open-ended versus closed-ended question. So, correct me if I'm wrong. So, open-ended question could be something like, what do you usually eat in your daily diet, for example? So
This type of question where it is give the liberty to the respondent to answer in whatever way he wants is an open-ended question. So you give him all the freedom to answer. Like, for example, as you mentioned, what are the items of food you intake in a certain meal?
All right. A closed-ended question, on the other hand, could be something like a yes or no question.
Yeah.
So it might be asking the participant if they smoke or not, if they suffer from a certain chronic disease, for example, hypertension or not.
Yeah, so closed-ended questions are very direct questions, hence the drawback of leading the respondent in a certain direction. So, for example, gender, male, female, a certain heart disease, for example, hypertension, yes or no. So this is a type of closed-ended questions.
All right, beautiful.
So formatting. So the questions must have instructions on how they should be filled out. Highly sensitive questions about income and sexual function are often placed at the end of the instrument.
And the doctor or the data collector needs to be society sensitive.
Yes.
So depending on the situation, you're going to tell your instrument to ask the question.
Mm-hmm.
So in more conservative societies, there are certain ways to ask a question. So, example, if you want to ask a person about their sexual history, it would be wise, for example, to ask if they are married or not,
Yes.
rather than directly asking about the sexual history.
And you can divide those questions. Like at the beginning of the questionnaire, you can ask about the marital status, but in the middle, you can ask, for example, about whether he's sexually active or not, to dissociate the two and get a more truthful response.
Yes, and it would be better for these forms of question that the participants answers them at their own disclosure, so you can give them the questionnaire to answer them it by themselves, rather than ask them the question
directly. Yes. So the next part is online surveys. So you have 2 options to do the administration of the assessment tool. You can either do it in print and distribute the printed questionnaire to the participants, or you can do it online using an online platform to collect the responses. So online surveys are generally clearer and easier for the respondent because they incorporate skip logic. So skip logic, for example, if we have a question about smoking and the respondent does not smoke, he doesn't have to see the question about how many cigarettes per day. So if he answers no, the second question, which is the amount or how many cigarettes you smoke per day, will be automatically skipped. This is the idea behind skip logic. Wording. So it's always wise to have a clarity should always be there. You need to make the questions as clear and as specific as possible. So an example of that, how much exercise do you usually get? So here is an example of not a very clear question, like how many exercise do we have in a day, in a week, in a month? So this is not very specific, not clear. A clear version of this question would be during a typical week, how many hours do you spend in vigorous exercise? So here we are clear, we meaning vigorous exercise, and we are specific to time.
This will also be of benefit when you're later analyzing the data. So one of them would give you categorical data that you need to compose together until you can find similarities between different participants. And the second question, which is the better one, you'll get continuous data that's better to analyze and will have a more well-perceived outcome.
Yeah, exactly. So simplicity, simple common words and grammar. So instead of saying in a question, drugs that you buy without a prescription from the doctor, it is very cluttered question. You can simply say over-the-counter medications. So this is a well-known term and it's not filled with jargon. Neutrality, so you should avoid loaded words and stereotypes that suggest a desirable answer. For example, during the last month, how often did you drink too much alcohol? So too much alcohol is not very specific and it is a not neutral question. So you are suggesting that the participant is drinking alcohol. This is the first thing. The second thing, that it's too much alcohol. So a better way of phrasing that question would be, during the last month, how often did you drink more than 5 drinks in one day? So that's more neutral question. Pitfalls. So you should always avoid having double-barreled question. So each question should contain only one concept. So if you don't combine two concepts in one question.
All right. So, for example, an example of a double-barreled question would be so a person saying, or a question that asks, do you agree that coronavirus is a pandemic and that people should wear masks all the time, for example? So that's a double-barreled question. It's unclear, and it might guide the participant to answer in some sort of
a certain
way.
direction. Yeah. So you should separate concepts. For example, playing on that example, so you should first ask whether he believes that COVID-19 is a pandemic. Then you can ask him if he agrees whether masks should be enforced. Hidden assumptions. So assumption that may not apply to all people who participate in the study. So this is the example of the double-barreled questions. This is another example. So how many cups of coffee or tea do you drink during a day? So coffee contains much more caffeine than tea and differs in other ways. So a response that contains the two beverages is not as precise as it could be. So another pitfall, the third pitfall, is the question and answer options don't match. So, for example, a standard depression item asks how often in the past week I felt that I could not shake off the blues even with the help of my family. So this is this example discusses the second pitfall, which is hidden assumptions. So here we assume that this participant has a family that help him with his depression. So this is a hidden assumption and should not be there in the question. So a final example. So have you had pain in the last week? Should not be matched with response never, seldom, often, or very often, because this is more of yes, no question. Have you had any pain in the last week? Yes or no. The question should be changed. How often have you had pain in the last week? And there, or the answer should be changed to yes or no for the previous question. So here are some example questions that we have developed in a previous project. So here we ask about, so the project in simply was discussing the occupational health in Saudi Arabia. So here is the section A1, demographics, which is usually the first section in every assessment tool. So you can ask about the age. You should be specific in years. Which nationality are you from? Again, very specific and directed. So this is an example of close-ended question. Again, the highest education, etc., etc. So here we can also observe two type of responses that we can gather. So the first one in years, so we'll input a number. So this is on a continuous scale. The other questions are on a categorical scale. Similar thing. So in that study, we have incorporated a assessment of sleep. So it is always wise to use a validated questionnaires. So if you want to assess sleep, it's always better. It's always advised also to look for a validated assessment tool. In this example, we have a validated one-item assessment tool of sleep that we have incorporated into the questionnaire.
So Dr. Khani, I think it would be good here if you could discuss what defines a validated questionnaire.
Excellent. That's actually a good point. So what is a validation? So how do we validate an assessment scale? So for example, the researcher that invented that scale had a difficulty because most of the existing sleep scales are multiple items and very large. So it will be very difficult to incorporate in an already large project to incorporate this large questionnaire of sleep, which is validated, the original one. So he developed this one. So it's one item. During the past 7 days, how would you rate your sleep quality? So, and this is on a 10 level. And then he administer this improvised scale with the original one, with the validated one. And then he compares the results. If there is actually a positive association that, yes, this single item scale correctly predicts the sleep quality compared to that already approved or validated scale, then yes, this is validation. So one might ask, okay, how do you validate the original scale? So that happens usually by the standard procedures, or for example, a physician or a clinician coming and doing the assessment himself, doing standardized processes. So then we compare the physician, which is the gold standard in this scenario, to our improvised scale, and that's also a way of validation.
Okay, so let's say I'm a student and I have a certain set of questions that I want to ask my participants.
Yeah.
So which would be better? That I make my own questions and then I try to validate them, or I check first?
So validation is a very time-consuming process.
Mm-hmm.
So it's always advised, and unless the concept that you want to investigate very rare and has never been studied before, in which scenario you have no choice but to use your own scale. There are many scales for the majority of things you might think of. For example, depression, anxiety, sleep, well-being. So do a quick search. If you find one that can be adapted into your questionnaire, meaning not changed but adapted as is, it's always advised to use a...
So for a student beginner who's starting their research process, it's easier and more efficient to check out validated questionnaires.
Yeah.
And then as you get more experience, you start to validate your own questionnaires and test them out.
Yeah.
All right.
So here is another example. So here, this is section A2. We asking about chronic conditions. It's very straightforward, self-explanatory. So yes, no, and the number of years. Here, we're collecting some sort of measurements, for example, height, weight, waist circumference, and blood pressure measurements.
All right, so an important thing here is that these are usually a part of every research. So there's the qualitative data and there's the quantitative data. And here there's an assessment of the patient's general characteristics and some unique laboratory tests. So when you're collecting the data, please remember that you need to train the data collectors so that they're all at the same level. They're all on the same page, okay? They're using the same equipment and they're using the same methodology when they're collecting the data, so that there's no variation in the results due to a methodology error.
Yeah, definitely.
Okay.
So now we come to the second objective, which is the components of an informed consent. So what are the features of an informed consent? So it's a disclosure of information to the participants. It has a consent forms, participant understanding of the disclosed information, the voluntary nature of consent. So those three are the features of an informed consent. So regarding the first feature, which is disclosure of information to the participants, so as the nature of research project. So the prospective participant should be told explicitly that the research is being conducted, what's the purpose of this research, and who is being recruited as a participant. The specific study hypotheses are not usually required to be stated.
Okay, so the first one is we're explaining what is this research.
Yes.
Okay? All right. Yeah.
Yes, the second part. So the procedure of the study. So in this item, we should also make sure that the participant are aware that they're going to be asked to do what exactly they're going to do in this research project. So on particular level, they should be told how much time they will be required and how often they need to visit. For example, if we're conducting a one-time survey, so they will be only required to present in one time. But if you're doing multiple assessments on multiple times, so they should know that, yes, you will be required to come on multiple occasions.
Okay, and this is an integral part of the procedure itself. For example, if you're conducting a trial and your participants are not well aware of the procedures, and you're telling them, okay, we're going to give you, for example, this intervention, and you'll need to come at regular assessments.
Mm-hmm.
Saying regular assessment is vague. Saying you'll need to come at the start of each week on Sunday at this specific time is more concrete. Okay.
Yeah, definitely, because those partners are actual people who have jobs, so we need to accommodate that. So another thing, in addition, in the same idea of procedure of the study, so procedures that are not standard care or standard of clinical care should be identified as such. If we are introducing a novel approach, we should inform the participant of that.
Okay.
So if the study involves blinding or randomization, as happens in randomized controlled trial, the concepts should be explained in terms that the participant understand. We should avoid medical jargon. In interview or questionnaire research, participants should be informed of the topics to be addressed.
Okay, so the final one is the risks and potential benefits of the study. So the potential benefits, they are important to the patients to get them motivated to participate in your study, okay? And you'll need to be truthful about the purpose of your study. What is your expected benefit? You don't need to make things up. As well as you need to explain the risks to the patient. So if your study involves an intervention or involves asking about specific details about the patient, like sexual history, for example, or drug history, the patient needs to be aware of this. Like you previously said, they need to be addressed in layman terms.
Mm-hmm.
And the problem with the medical professional is we need to transform what we know as like in
professionals
medical terminology into layman terms. So it's better to bring someone who is a layman and show him your informed consent. And if they can understand it, then that means you've done a good job in the informed consent.
So the second feature of an informed consent is the consent form. So they are required to document the process of informed consent, that the process of informed consent has occurred. So, for example, discussions between an investigator and the participant. The consent form needs to contain the required information discussed in the previous section. The third feature is the participant's understanding of the disclosed information. So avoid technical jargon, as clearly mentioned by my colleague, Dr. Mohammed, and complicated sentences. So some strategies to increase comprehension by the participants is having a study team member or a neutral educator spend more time talking one-on-one sessions with the study participants, simplifying the consent form using question and answer format to solidify the concepts, and providing information over several visits, not in order not to overwhelm the participants with information.
Okay.
So finally, the voluntary nature of the consent. So ethically valid consent must be voluntary as well as informed. Researcher must minimize the possibility of coercion or undue influence. So, for example, excessive payments to the participants to lure them into the study, or enrollment of students or prisoners as research participants.
Of course, what we mean here is that you involuntarily enroll students. So you tell them, for example, that um, you're a senior and you're telling your junior colleagues that they have to participate in your research. That's what we mean here. This is involuntary. So these are special groups. So prisoners are also special groups, and pregnant women, for example, and
Yes.
children. So they need to be part of the research process. However, that needs to be done in their voluntary,
Yes.
with their voluntary consent.
So
Okay.
it's not like we are saying here that you should not enroll students or prisoner in research participant, but extra care should be taken when dealing with such populations. So an example of informed consent. So this is again an informed consent that we developed for a project that we developed in the research unit at Samaraj University. So it discusses the thromboembolism in truck drivers. So the part one is the information sheet. So brief overview of the proposed study, the risk, the harms, the rights, the benefits, the confidentiality, and the ethical review, and the contact information. And the final part is the consent. So I have read and understood the foregoing information. I consent voluntarily to participate.
And of course, we give these based on the native language of the patient, okay, and the participants. So if they're Arabs, we give them the informed consent in Arabic.
Yes.
If they're from Pakistan, for example, we give them the informed consent in Urdu, so that the information is clear and the participant can understand it very well. Okay.
Definitely. So here's another example of an informed consent. So you can note that it is in Arabic because the targeted population was Arab speakers. And in this study, the target population was adolescents, so underage participants. So we took the consent of the parent.
This is an example of what we mentioned earlier. So this
Yeah.
is these are students. So the consent was actually from two participants. There was the consent from the parents first, because they are their guardians, and then we can get the assent from the student themselves or the adolescents who are in the children age group.
So objective 3 is the research budget. So this is an example of the budget form that we use in our unit. It's not, usually these things are more institution based. So every institution has its own format and way of processing budgets. But in general, depending on the project, we divide the costs according to the services that will be provided. For example, transportation. So here in our unit, we dedicate 60 riyals per car or per visit, or 50 riyals per vehicle. Communication. So the inner student communication at 30 riyals. This is just an example. Say printing, if you want to print questionnaires, if you want to buy some glucometer or glucometer strips, so you can add this as the material and supplies. Here we added, for example, files and bins, paperwork. You can add everything you want, and what's the item cost and how many items do you require, and this is the total, and you can explain the justification in this section. And finally, you can add some amount of money as an unexpected cost should something go south. And finally is the total budget.
Alright, so reading material is available in the video description below. We'll add some important material because we try to summarize most of the other important aspects that we have not discussed before of the proposal. Okay, thank you very much, Dr. Khani.
Thank you, Dr. Mohammed.